frequently asked questions about secondary hypertension in adults. What is secondary hypertension? Secondary hypertension is hypertension for which there is an identifiable cause. How common is secondary hypertension? About 10% of patients with hypertension have a secondary cause. In younger adults less than 30 years of age, renal causes such as glomerulonephritis and coarctation of the aorta should be considered. Primary aldosteronism, renal disease and obstructive sleep apnea are more common in older patients. Other less common causes are hyperthyroidism or hypothyroidism, Cushing's syndrome, and phochromocytoma. When do I suspect the patient has secondary hypertension? Important clues suggesting an underlying secondary cause are: young patient less than 30 years of age. Presence of symptoms or signs suggesting secondary causes. Indication of severe hypertension of higher than systolic 180 and diastolic 110, or resistant hypertension. Acute worsening of hypertension in a patient with previously stable control. What are the clinical situations that can further alert the clinician to the specific cause of secondary hypertension in a patient? Renal artery stenosis. Clinical situations that alert a physician to renal artery stenosis: the presence of a renal brute. A more than 30% rise in serum creatinine level after initiation of an angiotensin-converting enzyme inhibitor or angiotensin II receptor blocker. Discrepancy in kidney sizes of more than 1.5 cm on ultrasonography. Or recurrent flash pulmonary edema in a patient with normal left ventricular ejection fraction. Obstructive sleep apnea. Since many patients with OSA remain undiagnosed, a high index of clinical suspicion is needed, particularly in patients with drug-resistant hypertension. The presence of typical symptoms of OSA, such as loud snoring, witnessed apnea and daytime somnolence, or known risk factors for OSA, should prompt the physician to consider referral to a sleep specialist. Primary aldosteronism. Patients with primary aldosteronism are often aged about 50 to 70 years. Only a minority have hypokalemia and almost all are asymptomatic. Hence, it is important to consider screening patients for this condition. Some guidelines recommend screening patients with resistant hypertension, or controlled hypertension requiring 4 or more medications.
Audio Jungle. Audio Jungle.